Hello, everyone. Welcome to the webinar Farmworker Housing as a Social Determinant of Health, presented by Farmworker Justice. My name is Myra Ryder, Project Director for Occupational Safety and Health with Farmworker Justice. We are a nonprofit organization that seeks to empower migrant and seasonal farm workers to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. You can find out more on our website at farmworkerjustice.org. And just as a disclaimer, this activity is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents of this webinar are those of the authors and do not necessarily represent the official views nor an endorsement by HRSA, HHS, or the U.S. government. This webinar is being recorded, and a recording with Spanish subtitles will be available on the Farmworker Justice YouTube channel. You may submit questions to the panelists by clicking the Q&A button in the controls at the bottom of your screen, and you may also put your questions in the chat. Please feel free to send questions during the presentations, and if there is a particular presenter that you would like to address it, you can address the question to them. There will be a Q&A period at the end of the webinar when the panelists will answer your questions. And we have a great group of presenters today. They are Dr. Sara Quandt, Professor of Epidemiology and Prevention at the Wake Forest School of Medicine, Edward Kissam, Trustee of the Werner-Kohnstamm Family Fund, and he's also currently collaborating with UC Davis researchers in COVID prevention projects. Nargess Shadbeh, Director of the Farmworker Program at the Oregon Law Center, and Mary Jo Ybarra-Vega, Behavioral Health Coordinator with the Moses Lake Community Health Center in the state of Washington. Our presenters all have a wealth of experience researching, advocating, and helping address farm worker housing issues. So without further ado, I'll hand it over to our first speaker, Dr. Sara Quandt.
Let me get my slides up first. Good morning or afternoon, depending on where you are in the world. As Myra said, I'm Sara Quandt. I'm at Wake Forest School of Medicine, and I've been asked as a researcher to talk about 3 different topics, and you'll see them here. I'm going to talk about housing regulations for farm workers. Then I'm going to compare housing conditions with regulations, some research we did here in North Carolina. And then I'm going to talk about some of the common health outcomes of housing conditions. And let's see if I can make this advance. Okay, so first of all, talking about farm worker housing and regulations. There's really 2 kinds of housing when we think about farm workers. The first one is grower-owned or grower-contracted housing. And the second one is community housing, where workers just obtain housing in the local housing market for either short or long term. But let me go back to grower-owned and contracted. This is housing that is most often provided for migrant and not seasonal workers. If you have an H-2A visa holder, they have to live in this kind of housing. And grower-owned housing has to meet OSHA and state regulations. States are expected to inspect this housing and enforce regulations. So that kind of housing has regulations. Community housing really does not. There is no farm worker specific regulation on this kind of housing. It has to meet local housing regulations, but in North Carolina, all that means is it has a smoke detector in it. So it's important to, when we talk about housing, to realize that most farm workers nationally do not live in housing for which there are farm worker specific regulations. And there's kind of a continuum. North Carolina has a lot of grower provided housing, and that's where I am. California, on the other hand, has very little grower provided housing. So as we start to think about what the solutions are, it's important to note those. I'm going to talk briefly about some research that we did in North Carolina. Because we have a lot of grower provided housing, we were able to take the regulations that exist and compare and basically inspect that housing. And I'm going to give you the results of this. We went into 186 camps across 16 counties. We got informed consent from the workers, but we did not ask the growers. These are generally small camps. 61% only had one dwelling and about half only had 10 residents or fewer. About 2/3 had H-2A workers in them. So there was a total of 79 regulations that the state had, but when you boil those down, there really are about 39 things because there's some redundancy in it. So we used those items and inspected the camps. We used state law labs to get water quality, and we also collected wipe samples to look for pesticides. In terms of our findings, what we found was of the 39 possible violations, all camps had multiple violations, anywhere from 4 to 22. And if you look here, you can see the largest number of average violations was really for bathrooms and sleeping rooms. And I'll quantify some of those. And I just have some pictures up here of the not very good conditions that we saw. Some of the examples of violations that we saw was about 1/3 of the camps had unsafe drinking water. In the sleeping rooms, we saw a large proportion that had rodent or cockroach infestations. Some had mattresses just on the floor, not even on beds. Many met the criteria for crowding, which was less than 50 square feet per person. And we also found mold. There were other violations, but those are some of the main ones. In the kitchens, the biggest thing was refrigerator temperatures that were too warm. They should be less than 45 degrees. You can go home and check your fridge. But 2/3 didn't have that. Again, lots of pest infestations. Some places didn't have fridges or stoves, and about 1/3 did not have a functioning fire extinguisher. 42% had no wash tub or washing machine, and there was visible water damage in about 1/4 of the baths. One of the things that we looked at was heat in housing. You know, if there's excessive heat in the housing, people cannot rest and cannot recover from daytime heat. And I'm not going to go through a lot of this, but what you can see here is that on the right-hand side, let's look at the top graph. We divided the temperature and humidity into the heat index at no danger, lower caution, and then everything else. And you can see that the greatest number of houses are in the low caution or moderate or higher. And the black bars are if you have air conditioning. And basically, air conditioning doesn't do anything. It provides very little protection for the workers. So heat is a big concern in housing in North Carolina. Other things that we found, very little privacy in bathrooms. You can have 5 toilets, they're all in a row. Effectively, you only have 1 because nobody's going to use those unless there's privacy around them. We found lots of pesticides, including many that have been discontinued or were not registered. We found a lot of social isolation. Camps that were not visible from the road were in worse shape than those that were visible. Violations increased over the summer as more workers arrive and the camps fall into disrepair. We also found that camps that have H-2A workers had fewer violations, which indicates that regulations work. Those camps have to be inspected, and as a result, the growers were keeping them in better shape. So in summary, we found a lot of housing problems, and I list them on the left-hand side of this screen. There was crowding, and the health effect from that is likely going to be both communicable disease, and Ed will talk more about that, and mental health problems. We found lack of cleanliness and refrigerator temperature. You're going to have foodborne disease, poor water quality, waterborne disease. There are lots of causes here for respiratory symptoms. When you look at what we found for heat, it's likely there will be heat illness and exhaustion, and that often leads to unintentional injuries. With the pesticides, we know that there are poisonings that happen with children in the home. And the other things that we found, many of them relate to mental health and issues of mental health. So the research that we did in North Carolina, we were able to take a set of existing regulations, because we have those here for housing, and compare it to what's really on the ground. And what we found was a very high number of violations, and they were violations that are likely to have health effects in the long run for the farm workers who live there. So I'm going to stop here and let Ed take over.
Okay. Okay, I'm going to focus on looking at a specific problem, which is the COVID-19 pandemic and how crowded housing affects that. Myra, if you could move us forward, thank you. The social determinants of health specific to COVID-19 interact with each other. COVID-19 is thought of as having three major domains of transmission: workplace, home, and community. For farm workers, we have to add crowded transportation. The reality is that one needs to look at interactions between these domains, because if you try to control COVID transmission just in the workplace and not in crowded living quarters, there's a two-way street, so it doesn't work so well. We did analysis halfway through the first year of the pandemic, and at that point, farm worker communities had about 1.5 times the cumulative incidence of COVID-19 as the counties surrounding them. Let's go on to the next slide. The extent of crowded housing more than doubles the risk of infection. About a quarter of all farm worker households are crowded versus 6% of US households. There are also these super pockets of crowded housing in places where lots of people go to work, particularly peak season. Crowdedness is one major factor that affects COVID-19 transmission, but household size also matters. So as you'll see, the case studies we've done have shown farm worker households to be about twice as big as the average US household. Let's go on to the next slide. Here's an example of a crowded household, and it's a household that's referred to by Census Bureau researchers as a complex household or a doubled up household because different families are living in the same place. Let's go on to the next. And here's another. This family is living on their own, but as you'll see, it's still a crowded, large family. Let's go on to the next slide. So one of the problems in the COVID-19 pandemic for farm workers is that CDC and other public health authorities were very slow to understand the implications of crowded housing for COVID transmission. So the initial guidance about go home and isolate yourself was a disaster. Happily, that's been appreciated more and more as time goes on. It's important also to understand that housing is not just a generic thing, but there are different kinds of farm worker housing. H2A congregate housing was always understood to be a problem, but there's also lots of crowded local housing, trailers, apartments, doubled up complex households. So this slow recognition led to pretty burgeoning transmission in farm worker communities. Let's go on to the next slide. It's important to understand also, you can look at National Agricultural Worker Survey data about overall conditions. And as you heard from Sarah's presentation, that's what's going on nationally. About housing conditions are worse for migrants and for undocumented and mixed status families. About 2 out of 5 living in crowded housing. Indigenous family households are also more crowded than mestizos. We have limited information from California, but it's pretty evident. In hotspots for migrant labor, extreme crowding is common. The Salinas Valley provides a really good example where 93% of farm workers are living in crowded housing, and about half, slightly less than half of those crowded households are classified as extremely crowded. 16% of the farm workers didn't even have a bedroom to sleep in. Same story in Immokalee, for example, another area I know pretty well. Typical mobile home with 8 workers in it. Let's go on to the next slide. The diversity of household composition is kind of multidimensional. One has to pay attention to the housing structures and living spaces, and also the neighborhoods. Also, household composition, how that affects transmission, the type of housing, which are single family homes, mobile homes being particularly problematic, but also apartments and all. It's also important to keep in mind that many farm workers live in urban areas. So one can't just go out to the fields and deal with the issues. Neighborhood context matters, both positively and negatively. Crowding is also fluctuates in some places because there's high household turnover. In Fresno County, for example, we discovered that this one household, indigenous household, varied from 4 to 19 people over time. Let's go on to the next. So here's a picture of a Mixteco trailer park in Kerman, California, Fresno County. And crowding is both negative and positive, because in those crowded households, there's a lot of conviviality. People share rides in those vans, the kids play together, neighbors visit from one trailer to another, but it increases transmission. Let's go on to the next. Here's another picture of how crowded housing affects things, because no matter how many social distancing guidelines and masking guidelines one promulgates, it's just not easy to keep those guidelines in mind in crowded housing after a hard day of work. Let's go on to the next. And here is an example of what happens when diverse social networks interact. These guys are living in makeshift housing. They get along well, but those diverse networks are a concern in terms of spread of COVID variants. Let's go on to the next. So what this means is we really need to dig deeper than these high-level general notions of outreach and promoting vaccination and so on, to look at what really is going on, what are the actual dynamics in the real world. And the thing that's most important about crowded housing is that it's a problem in terms of transmission of COVID, but it's also an opportunity for providing a hotspot for conversations about people's problems, their beliefs, their attitudes, and their aspirations about protecting themselves from COVID-19. Those informal conversations are really crucial. Let's go on to the next. So this has some immediate implications for better COVID-19 response strategy. First of all, the idea of just reaching out to individuals isn't so good. One has to reach social networks, which will then talk about the issues. Second, and we're doing this with the UC Davis efforts, is you have to adopt a whole household strategy for COVID testing. So people can get tested right away, and everyone in the household is tested, and those who are at risk are protected somewhat. You have to adopt a whole household strategy for COVID-19 vaccination campaigns, also remembering there are these complex households, which are not just single families, but people who are sharing housing. You need to also foster self-directed contact tracing, counseling to say that if someone in the household is positive, everyone else should get tested and some should get access to treatment. The access to treatment issue is one which is now an emerging one, because there now is effective treatment for high-risk individuals who would have really serious outcomes from COVID. Let's go on to the next slide. So the long-term implication is that Delta and now Omicron sets a new benchmark. Action has to be extremely fast at light speed. No time for farm workers to wander the internet, no time to read pamphlets, and crowded housing is the place to communicate. So let's go on to the final slide. And I think the bottom line is that the future is to mobilize the full potential of social networks so that interventions are configured to make households the fulcrum for pandemic response. So that's it. At the end, I included some references, which Myra will send out the whole slide deck to y'all. Okay, thank you. Onwards to Nargess. Look forward to hearing.
Hello, everyone. I appreciate the opportunity to participate as a legal advocate from our world of legal services with such an impressive panel of folks. And I mean that sincerely, because I have benefited from the panelists' knowledge and depth of experience for years in working on occupational health and safety in Oregon. And the reason that I think that people wanted me to speak today is in part because the work that we did early on with regard to improving or trying to reduce the risk of COVID, in particular in labor housing in Oregon back in March of 2020, and then later work we're pushing to adopt temporary rules in excessive heat, also in farm worker housing, smoke hazards in workplaces in farm worker housing, and continuing the work of trying to improve the labor housing standards. And so what I have to share with you today is a glimpse of what it is, at least as of 2019, with regard to major issues in labor housing in Oregon. And you know, Oregon is a state plan like the other 22, but it doesn't deviate from the national standards vastly. And my comments are largely for the migrant housing, the ones that are employer provided, and doesn't necessarily focus on the H2A portion, although many things are similar. So let's start with just some of the major problems with the standards. And as to the legal advocates, I would urge you to think about your own state. And I know that the standards are slightly different, and some states have improved, but just generally thinking about what are we missing in these standards? First of all, at least from the COVID standpoint, the smoke, excessive heat, there's no standard for ventilation controls other than, you know, a tenth of the square footage has to be for windows, some of which should open. There's no requirement, at least in Oregon, for flush toilets and sinks adjacent to them or designated for toilets versus, you know, kitchens. There's no requirement for even providing a cooking facility. It says if provided, then do something about it. I know H2A is different, but I'm just talking about general, you know, labor housing. And Sara mentioned this. Where the heck is air conditioning, if at all? There's no cooling requirement for these rooms, and increasingly more important. Sara mentioned a rule of thumb of 50 square feet per person, and under that you've got overcrowding. And you know, and I know that the square footage for quote bunk beds is one person 40 square feet. So essentially during COVID period, you could have 4 people in 160 square feet with 0 ventilation, and they called that good enough. If you don't have bunk beds, we know it's 1 to 50. And in Oregon, if you have cooking in the same room, then it's 1 to 100. Showers and the use of sink mix and all of that is the ratio is abysmal, as you know. And then the washing machine in Oregon, which I think is slightly better than the federal, assuming you have a washing machine, is 1 for 30 individuals. And then the biggest of them all is there's no minimum distance that is required between where that wall of the housing is erected and where the field begins. So those orchard trees could be touching the windows where people go by and spray, you know, depending on the label, that's all good and well, but there's no fixed distance between where people's house is and the field. Next, please. Okay, this one I wanted to show you because remember I told you about the toilets. Now, theoretically, the toilets have to be a certain distance from where people reside, but those little rooms with the yellow arrow to it, families live in that, and I dare say it's way lower than 100 square feet. And the line of toilets is right outside their rooms. And then there are rooms above there too. And this place, unlike what Sara was describing as isolated, is right up to the road. And problem for us as legal aid lawyers generally is, look, we've got to represent clients before we bring in complaints. And so if folks here don't complain, I can't file it in my own name. And so there it sits year after year. And this is lack of enforcement, of course, but then not seen from the road is not terribly different in areas where there are housing, although there are, a whole gamut of housing. Next slide. The laundry, I've already talked about the issue of the 1 to 30, and this comes from the farm worker herself, that they need at least for the ratio to be something closer to 1 to 15. So when you're advocating for changes in the labor housing, one of the things that we can focus more heavily on is the ratio on the laundry facilities that are available. Next, please. And then the proximity that I told you, the lack of laundry means clothes on the trees that may or may not have been sprayed, the proximity of the trees to the housing. Next, please. Here, we advocated in 2008 that if you cook inside those rooms, the square footage should be at least 1 to 100. What did the employers do? They shoved the stoves outside the rooms. Aha, now we don't have to do 1 to 100. And notice the walls of metal, and just imagine what that place inside is when the temperature is when the temperature outside is, 100 and above. And notice the open area in which drift and residues could easily land. And where is the sink? Where is the food preparation area? This all passes muster right now with the regulations in place. Next, please. And this is the dining area because it's too hot inside. And then you could see the whole length of the parking lot and can imagine what the solution is when there is COVID. Next, please. And then the protection for the standards for the housing itself is protect you from the elements. And this is the condition that this, I dare say, is probably better than some because this at least has an attempt at insulation. Next, please. This is the solution, the problem with the bunk beds, as others have pointed out, the proximity, the top to the bottom is 27 inches if they're in compliance. And then there's the distance in between. And I just want to say, despite bringing in the best scientific evidence early and often, I mean, we asked Mark Lipsitch, who's the head of Harvard's epidemiology disease, to give us a declaration that I've posted online with FJ before, and it was at Harvard's School of Public Health for a while. And he was talking to us early on about, look, this tarp between the beds and then the focus on droplets is not enough. This thing is airborne. Nonetheless, given this configuration, our state's OSHA, just like a lot of others, suggested that tarps and then the so-called distancing, that wasn't good enough without attention to any kind of ventilation in these crowded rooms. So square footage, when we're arguing for changes in the rules, we should not take it as a given that the 1 to 40 or the 1 to 50 or the 1 to 100, at least in our state and nationally, is God-given. For so long, our clients have had to suffer with such abysmal, outdated, going back to 60, 70 years, that people just assume that this is farm worker housing. Well, why is that? Next, please. I'm so sorry about the slides moving on, and the fan speaks for itself. Next, please. And then the bathrooms. Remember, I think Sara was talking about 2 places where there were huge violations in her study. One was the bathrooms and one was the sleeping rooms. Now this, I would say, is an average to better bathroom. It has shower curtains. It has, I think, 1 sink for that bathroom. And if it has toilets and there's not separation, I really like the way she said, you got 5 toilets in a row with no privacy, you got 1. And when we bring this up in trying to battle on the issue of ratios, farm workers are called selfish for shutting the door and not letting others in because they don't have enough privacy in these types of situations. And the moms in particular who have to delay until the end of the day. I mean, 10 o'clock is super late for most farm workers who get up at 4, but having to delay in order to do basic hygiene for themselves. At the same time that we talk to people about worker protection standards and, immediately when you get home, take a shower and don't touch your children, right? Next, please. Next, please. So I just wanted to, I don't know how much time I've got left, but I wanted to hit on ventilation. Ventilation requirements for high density areas when you got unrelated people, meaning not part of the same household before they came. As you know, in COVID, often people said, oh, they are part of the same household because, they were H2A workers came up here in the same bus, or they know each other. That's not part of the same household and caused a lot of issues. So high density and lack of ventilation. And one of the things that we learned during this as advocates is that the ventilation exhaust fans don't need to just be in the bedrooms, but they have to be in the kitchens, they have to be in the bathrooms, they have to be in the toilet area. Often we don't pay any attention to that. And I also learned that you need to have, it's not just enough to open the window if there's not wind, because the air change in the room may be like once per hour. Whereas like in COVID period, or just generally when you've got high density, you probably need a minimum of 6 air changes per hour. So if you're going to push air purifiers, one thing I've learned is that they should have strong filters. You can't just have, strong fan without the filter. You need the HEPA filters, and you need a minimum of, 4 is okay, it's not great, but you want to push for 6 changes per hour. And I have to say on this note, we pushed and pushed and pushed on this. And now with additional funding that the state got, instead of putting out brochures, one of the things that they've done is bought the air purifiers and directly put it in the hands of migrant farm workers, seasonal farm workers, so they can use it in their own places and or if they go into the labor housing. I'm not saying that's ideal, but it's sure as heck something practical that we can do. And we need to bring in more focus on ventilation in these rooms. And the more we increase the awareness and the demand from farm workers, from other social networks, from other community-based, from the clinics, this point will have to be driven home. And for those who are worried about costs, because you will get that, the cost that we learned these air purifiers have for electric is like a laptop. Next, please. The square footage I've already hit on, but I've learned that you shouldn't just focus on the square footage. You should also figure what is happening in that space. So the picture that Ed showed, and that's typical of a lot of the labor housing with, people basically have their beds and that's where they're storing stuff, or right around it or underneath it or adjacent to it. But that takes away from this square footage. And so when you are, 6 feet, whatever, there's no room to be doing that. So you do need to have a minimum square footage per person, whatever the heck kind of beds they put in. We need to argue for at least the minimum of 100 and 113, at least if there's cooking inside. And also the height of the ceiling is important, because a lot of these places, at least in Oregon, have less than 7-foot ceiling. So pay attention to the ceiling, the square footage, how much room people have in between, not just during COVID, but practically speaking for these living areas for our client communities. Next, please. And then, like I told you, in Oregon, at least, it says kitchens if provided, and then they push the kitchens out. You can only imagine about the residue and drift, especially since the cooking area, there's no special distance between the housing and the fields. But more than that, I mean, just think about the hygiene. How many times you've gone to the labor camps and you have found no sinks around, and people are supposed to wash their hands between washing the lettuce and washing their chicken. A lot of people are wash their poultry by practice, or cooking in between. It's like there's no water in between. And to this day in my state, they can put a igloo container in the rooms with some cups, and that does it as far as water availability. And the water availability is 1 person, 35 gallons. You notice how much water people use among, in general in other places other than labor camps, and it's much higher than 1 person, 35 gallons. And we need to change those standards. And the other thing, one thing that we have tried to push in the temporary rules because of excessive heat, because of smoke, is use these common kitchens. And many states have them too. Instead of the facilities having their own kitchen, they have a common kitchen with a row of stoves. But also think about these rooms as cooling spaces. Our clients don't bus it into town to stay at the library or the rec center to cool off. They don't do that because for a variety of reasons you already know. But at the housing, at the labor housing, with minimal time that they have for preparation for the next day, introduce air conditioning into the cooling, into the kitchen or a common area, plus the air purifiers. Use the air purifiers as air conditioning too, because the technology is there. And you know, the air purifiers can also act as assistance for smoke hazards in these areas. So there's multiple use of same technology. And this is particularly useful because most labor housing operators say, look, we don't have the infrastructure to put in all this electrical stuff that you want, but you sure as hell have one room in which you're doing, you know, for common kitchen. Turn that place into a humane place where there's air conditioning, etc., so people can get some relief. I don't know if I have another slide. I think there may be something about bathrooms. Next slide. I don't know if I've mentioned this or not, but what I heard from experts, and I just want to share this quickly with you because I know we're just talking about housing, but in the fields, in labor, in hand harvest crops, and I know that there are non-lawyers, health center, health providers, public health folks on this. I want you to hear what I'm saying, if you could remember this. The ratio for toilets in the fields where people pick, you probably already know this, but it's one person, at least in Oregon, I'm sorry, one toilet for 20 individuals. And they have, as of 2004, a rest break of 10 minutes. Finally, farm workers got rest breaks. But the catch is that toilet can be a quarter mile away, 5-minute walk. So what I just want to highlight is the hygiene and terrible, abysmal situation in the field as far as protection, and then the carryover into the labor housing. Thank you for your attention. I appreciate it.
Presenter is Mary Jo Ybarra-Vega from the Quincy Community Health Center in Washington. Mary Jo.
Buenos días a todos. Good morning, everyone. What a great presentation by my amigos here on the call this morning. Myra, if you wanted to pull up my slides, that would be great. Thank you. So you guys, good morning. I'm going to speak briefly this morning about the strategies that we at community health centers and other community-based organizations are using to help with housing problems. The presentation I'm going to be talking about primarily is going to be focusing on some of the more long-term strategies that we've used in the past to get us to where we're at, and we still have a long ways to go. So if we could go to the next slide. So the agenda this morning, I want to talk a little bit about how we use research. So I'm glad there's lots of researchers on the call this morning. Also how we use promotoras. The promotora program for me is essential in using it as a strategy to help with housing issues. We're also going to be talking about allies and partnerships. And finally, for me, one of the most important pieces is using community voice, those individuals who are most impacted by poor housing. So if we can move them to the next slide. The first topic is I wanted to talk about research. And I think given the timeline, I'm going to just play, if Myra could just hit that YouTube button very quickly. I'm just going to have her stop at a certain spot so we don't use up that much time.
1 room and a half, family of 4. One of them sleeps on the couch. The other one sleeps on a mattress. One of them has a room, but has everybody's clothes in their room. The other one has to have a bunk bed, you know, and the kids, they don't grow up with their own rooms like you would imagine. Their private space, nothing like that. It's, you can hear through the walls. It's like as if they're made out of paper or something. There's no privacy.
Okay, Myra, let's go ahead and stop it there. So that last clip that I was, unfortunately, it's great. Maybe it'll save us some time. Maybe that's a teaser for you guys to go back to the YouTube and look at that video in its full form. But basically, we used photo voice as a form of research about what housing conditions were of farm workers in our community here in Quincy, Washington, which is a really small north central Washington town, primarily Latino farm worker ag-based little community. And what happened is we used promotores de salud, and they were very young, and we basically had them go out into the community and take pictures to tell the story of farm worker housing. We kept getting leadership in our community saying, oh, there's enough housing. And we actually used it as an advocacy tool to bring awareness about the lack and the conditions of housing. And I think we kind of made the community aware that what they thought was our reality was not. So it was a very powerful tool. And again, we use promotoras to do that. And just like Sara and Ed and that are researchers and do that kind of piece, we work with individuals like that, universities, the University of Washington and Washington State University. We have great partners there who ask us to become involved with community-based research. And one of them that we did along with a friend of ours was the Washington State Farmworker Housing Trust Fund study. And that was done very early on when it came to the clinic. And basically we went out to farm workers and asked them about housing. That information later became important because it helped us with efforts that we used in order to team up with our city and our county, and later the Yakima Diocese to help change zoning areas so that we could bring in the Yakima Diocese so they could bring farm worker housing into two large complexes into our area. So that was very helpful. Again, using researchers, being part of research, and I think having trusted individuals like promotores go out and collect that data, super important. And I don't think there's a better way of doing that kind of work. So let's go to the next slide. The second topic I want to discuss, and I've already been alluding to it already, is using promotoras de salud as a strategy. I think that when you're doing any kind of strategy working with farm worker populations, you want to use promotores de salud, or community health workers that come from that community. Absolutely essential. I don't think we can go back and do it any other way. I think the pandemic's shown that promotoras are a strategy, and it's been successful, and we couldn't have done anything without them. And that includes, for example, all of the work we did with housing. And again, that picture that you see there is one of the very first trainings we did several years ago, and all of these folks, I would say, are the seeds of a great promotora and community health worker program that we now have throughout the state of Washington. So can we go to the next slide? I just love this saying by Walt Disney, the way to get started is to quit talking and begin doing. And I think that's what promotoras do. We hear what the community says, and I think, like Ed said, we have to be lightning fast. I'm not sure if that was Ed or Sara, but we have to be lightning fast. And when we get the information, we have to be out in the community, in houses, with the workers on where they live at, and in the community where our farm workers live. So next slide. And in just very quickly, I'm going to the third topic I wanted to discuss was allies. And in our town and in our region, some of the biggest allies have been the city of Quincy and Grant County Housing Authority. And we actually work with them even now when we find people who are homeless or need housing or assistance with funding for housing right now. And so we work very closely with them. And one of the really great pieces is one of my ex-promotoras, she actually now works in a department. So having promotoras who have grown up with us and now sit in very important positions also, they become allies for us as well. And then also the Diocese of Yakima has been a really great player with us as well, bringing in that housing that we need. And of course, people like Farmworker Justice, who is celebrating this 40th year. Just can't say enough about that team. And can we go to the next slide? And I think, again, most importantly, I wanted to speak about community voice. I think that when we're doing any kind of work with regards to what are the issues, we need to be talking to the community in their settings, and we need to be doing it with people that they trust, so they feel free to tell us things that maybe other researchers wouldn't pick up or their providers wouldn't pick up. We have that ear, we have that trust, and we also have that heart of service that I think people are drawn to. They know us. So when we go out and we talk about what the housing issues are, or for example, food insecurities, they're going to tell us that information first before they tell us about their health needs or before they tell us about other issues, and even before even getting vaccinated. So I think for me, the community voice is very important in research that we do, in the outreach and how we develop programs for them. And I'd have to say that for me, one of the biggest pieces in the success we've had here at the Community Health Center, in Quincy in particular, is that we've listened to that community voice from farm workers. And when we created a curriculum, we made it better because we were out in the community listening to what people were saying, the concerns that they had, and then we built a curriculum based on those needs and those comments that we were hearing from the community. And so that's been excellent. And again, we've built a prevention education piece for COVID, for farm worker housing, in particular H2A housing, and also have built along with that piece is vaccination education, also built on the concerns and hesitancy of farm workers. And we've been able to create some other great tools that we've shared through Farmworker Justice and other programs. And I know we're running short on time, and I know lots of you guys have questions, so I think I'll stop there. And I think we'll just move on, Myra. I am watching my watch, so I'll stop there.
Thank you, Mary Jo. Thank you to all the presenters. So now we would like to take some questions from the audience. We have just a few minutes. So one of the questions we had, I think this was for Sara. Most farm workers in the US are settled, according to NOS, thus live year-round in their own or rented house or apartment with their family and other workers. Are you considering those farm workers in this presentation, or only those living in employer or community provided housing?
When I differentiated the two types of housing, community housing, I think that is for seasonal and settled out workers. We did not inspect that housing in the research that I reported. And so, that housing will vary from place to place. What we've seen here is that as people settle out, oftentimes their income increases because in the winter they're working in construction or they're able to get off-farm employment. And they also can do work on their dwelling. So we see, I think it would be fair to say, better housing for seasonal workers who have settled out than we do in the kind of housing that I was talking about, which was the grower provided housing.
Thank you. And a follow-up to that, are the results of the research that you mentioned published?
Oh, yes. There are a lot of publications, and in the last two, when I'm not sure who, but Alexis said that the presentations would be sent out, the last 2 pages of my slides have those citations. I will also note that Farmworker Justice and a couple other places sponsored a housing conference several years ago, and I included the proceedings or the working papers that were developed from that.
Thank you. And let's see. We have another question. Why is it that some states have so much employer-provided housing, like North Carolina, and some have so little, like in California?
My glib answer to that is for historical reasons. I mean, California sort of made a decision not to do that. And because the growers did not want to be responsible for it. As they've gone to H-2A workers now, some of them have had to go backwards and actually rent out motels and things because they had no grower provided housing. But I think it simply is historical reasons.
If I could just quickly add to that, at least speaking in Oregon and maybe to some extent Washington, when you have labor intensive crops and you have people historically, just like Sara says, for short periods of time, in order to be available to the employers in this labor intensive crops in the middle of the night, in the early morning, whatever, they saw it to their benefit to provide the housing. And I don't know if that is true across all crops, but I do know on the labor intensive crops, that's true. The other thing that's really important, we didn't have a chance, but Sara and others and Ed have touched on it, is this off-site housing and the motel placed housing, where the reason I say it is that both state and federal provisions exempt regulations largely at these motel operations because they say it's commercially available to everybody else. And so there's got to be good. But if you look at the incidence of COVID-19 and where it occurred and the intensity across the board from the East Coast to West Coast, California, everywhere, the motels are a hotbed for the overcrowding and everything else, even though they have plumb toilet because of the overcrowding, because of the density, etc. So anyway, I just wanted to add that. Thank you.
Thank you. Ed, I think you have your hand raised.
Yeah, I just wanted to add that in California, there's been very interesting discussion about the fact that simply providing housing for migrant workers is not adequate, that really the ag industry has to chip in to deal with the fact of crowded housing for local workers and their families, as well as the migrant workers. And the kind of policy solutions will have to be very much out of the box in terms of shared investment in overall improvement in housing conditions in farm worker communities, because all of those communities have crowded housing for everyone.
I think the one piece, Myra, that we haven't talked about here, and maybe we've been alluding to it, is advocacy. Absolutely another strategy that all of us use, you know, in research and using the law, but also advocacy from allies like Farmworker Justice and other farm worker based unions and allies within our own medical systems. I think those, and when we team up together, when there's those medical legal partnerships, and when advocates get together, like on our calls that we hold every other Tuesday, that now consist of people from all the West Coast, miraculous things begin to happen, and we push agendas that maybe when we were one state, but now that we're 3 states, we can push the agenda and the issues that that we know are important from the community, and having the voice of the community members on our calls, absolutely essential as well.
Thank you, Mary Jo. Unfortunately, we are out of time, but tomorrow you will all receive a follow-up email with the resources that our presenters have shared. And at that time, if you have any additional or follow-up questions that you'd like to ask, you can let us know. Thank you so much to our speakers for those great presentations. And before we conclude, we'd like to ask everyone to please fill out a very brief evaluation survey for this webinar. It will take just 1 minute, and we've posted the link in the chat. So if you click the chat button at the bottom of your screen, look at the chat, you'll see it there. And we'd really appreciate it if you could go ahead, click that link, fill it out, because your feedback would be very helpful to us as we plan future activities. And once you have it open on your browser, you can continue working with it after we sign off. And as I mentioned previously, the webinar recording will be posted on our YouTube channel and will be shared on our social media channels. You will receive an email containing that link to the recording tomorrow, along with the listing of resources. And with that, we conclude our webinar today. Thank you to all our presenters and to all of you for joining us. We hope you have a great day.